Yeah, I'm wearing my retainers, so if I sound funny, that's the reason why, all right? Don't judge me, judge your auntie. But I want to talk about blood transfusion today. When you're hanging blood, right, you are the last line of defense between a life-saving treatment and a fatal reaction. This is not a regular IV infusion, okay? So we're breaking down the high-stakes protocol for blood transfusions right now. So go ahead and grab your textbooks. But y'all, before we start, hit that save button. Blood transfusion is a heavy NCLEX topic and a critical bedside skill. So drop a in the comments if you've already witnessed a blood transfusion in clinicals. Step 1, the patho breakdown. So we administer blood or blood components due to blood loss or anemia. The goal is to restore the oxygen carrying capacity of the blood. You have to understand ABO and RH compatibility. If the patient receives the wrong blood type, their immune system will attack those donor cells, leading to hemolytic reaction that can cause kidney failure or vascular collapse. Step 2, risk factors. Every transfusion carries a risk. We watch for febrile non-hemolytic reactions, which are the most common and allergic reactions to plasma proteins. But the most dangerous is the acute hemolytic reaction from a mismatch. We also have to watch for TACO, which is transfusion-associated circulatory overload. This happens if the blood is infused too fast, especially in patients with heart or kidney failure. Step 3, manifestations. So for the first 15 minutes, you have to stay at the bedside. Watch for classic signs of a reaction like fever, chills, low back pain, itching, hives. If they have dyspnea or tachycardia, increased blood pressure or crackles in the lungs, think circulatory overload. Any change in mental status, anxiety, or a drop in blood pressure is an immediate red flag, okay? Step 4 is diagnostics. Before you even get the blood, you need a type and a cross-match performed and a signed informed consent on the chart. You must have a dedicated IV access with a 20 gauge or larger needle. You have to set up your Y tubing with only 0.9% normal saline, okay? Nursing priorities. You must start the transfusion within 30 minutes of the blood leaving the blood bank, and it must be completed in 4 hours. Step 5, interventions, okay? Nursing interventions. So you must perform a double verification with another nurse or a physician at the bedside. You want to check the patient's ID, the ABO group, and the RH type, and also the expiration date. Start the infusion slowly, no more than 5 milliliters per minute for the first 15 minutes, okay? If you suspect a reaction, stop the transfusion immediately. Disconnect the Y setup at the access point and maintain the IV line with normal saline through new tubing, okay? Notify the doctor and the blood bank right away. All right, step 6, education and signs of improvement. You want to teach the patient to report any itching, chills, or difficulty breathing immediately. All right? What does success look like? How can you tell your interventions is working? If your patients are stable, like their vital signs, that's a good sign. You want to see an improvement in their symptoms of anemia, like less fatigue and better skin color and a stable fluid status, okay? That's it for this video, guys. But listen, remember this. Everywhere you go, you leave a legacy. You are building a footprint of excellence. Your behavior speaks to exactly who you are as a nurse. So what legacy do you want to leave? Y'all, stop overcomplicating your study sessions. Follow this 6-step framework and let's crush these exams together, okay? And listen, I'ma always leave you with this. Never dim your light for anyone. Stay lit.